Hello everyone, welcome. Recently I was asked if chemical sunscreens can be vitiligo inducers. I was specifically asked about avobenzone and if there was any scientific evidence that it can cause vitiligo. A very thought-provoking question, and this talk today is focused on avobenzone. I will do a series of talks on vitiligo, and I would like to take a look at chemicals, metals, and other factors that are linked with vitiligo in the coming weeks. But today I would like to focus on avobenzone. Avobenzone is a common ingredient found in many sunscreens, primarily used as a broad spectrum UV filter to protect the skin from UVA radiation. While there's no direct evidence suggesting a causal relationship between avobenzone and vitiligo, some individuals with vitiligo or other skin conditions may experience sensitivity or reactions to certain sunscreen ingredients, including avobenzone. Michael Turmer in 2021 in his paper does say that avobenzone degrades irreversibly when exposed to sunlight or other UV light, and this photodegradation results in breakdown products which can react with the skin. A decrease in the protective effects of the sun filter is perceived, and this can cause adverse effects like skin irritation, aging, phototoxicity, photoirritation, as well as photoallergic reactions. And the breakdown products formed can also cause DNA breaks or damage. And this has been seen in vitro cytotoxicity studies with human keratinocytes. So here are some important things to consider regarding avobenzone and vitiligo. Skin sensitivity. Individuals with vitiligo may have heightened skin sensitivity, which can make them more prone to irritation or allergic reactions from certain skincare products, including sunscreens containing avobenzone. So while avobenzone is generally considered safe for most people, some individuals may develop skin irritation, redness, or allergic contact dermatitis when they're exposed to this ingredient. It can also be like a potential trigger. So while avobenzone itself is unlikely to cause directly vitiligo, but it's essential to think or consider that potential triggers for vitiligo exacerbation or flare-ups can happen. And some individuals may find that certain chemicals or environmental factors like sun exposure can also exacerbate their vitiligo symptoms. So in such cases, it's advisable to choose sunscreens which are formulated for sensitive skin. They're also labeled hypoallergenic or fragrance-free. And patch testing is good. Individuals with vitiligo who are concerned about potential skin reactions to sunscreen ingredients like avobenzone should probably do a patch testing, and they may benefit from that. Patch testing generally involves applying small amounts to the skin and to assess for any adverse reactions or sensitivities before using it on the whole body or everywhere else. This can help identify what ingredients may trigger irritation or exacerbate certain existing skin conditions. Of course, there's alternative sunscreen options for these individuals who are sensitive or have vitiligo to avobenzone and other sunscreen ingredients as well. These alternative sunscreen options such as mineral sunscreens which contain zinc oxide, titanium dioxide are well tolerated for sensitive skin. They also provide broad spectrum protection against UVA and UVB radiation. Additionally, of course, seeking shade, wearing protective clothing, avoiding peak sun exposure hours can also add to sun's protection. And overall, again, while avobenzone is considered a safe and effective UV filter in sunscreens, individuals with vitiligo or sensitive skin should exercise some caution and consider alternative sunscreen options if they experience skin irritation or reactions. Of course, consulting a dermatologist or a healthcare provider can give you some personalized recommendations for sun protection, and also some skincare which is tailored to individuals' needs and concerns. So, sunscreen is essential component of skincare for individuals in general, and especially for people with vitiligo. And having some protection from the UV radiation, it prevents sunburn, minimizes tanning, reduces inflammation, and also slows down the progression of vitiligo. It's of course important to incorporate sunscreen into daily skincare routines, and also to choose products that offer effective broad spectrum protection for optimal skin health. So vitiligo is a long-term skin condition which is characterized by patches of skin losing their pigment, and the exact cause of vitiligo is not entirely clear, but it is thought to be an autoimmune disorder in which the body's own immune system mistakenly attacks and destroys the melanocytes, and which are cells that produce the pigment in our skin. And this results in white patches on the skin, which can vary in size and location. Vitiligo can affect any part of our body, but it typically appears on areas which are exposed to skin, such as our face, neck, hands, and arms. It can also affect the mucous membranes and the retina. So vitiligo is not its prevalence varies from different populations and regions, and it affects people of all ethnicities and both sexes equally, and the estimates are generally about 0.5 to 2% of the global population has vitiligo. It can develop at any age. Most people with vitiligo develop it before the age of 40. However, it can occur later in life as well. So the exact cause of vitiligo still remains unclear, but it's believed to involve a combination of genetic, autoimmune, environmental factors, and certain genetic predispositions may increase the likelihood of developing vitiligo, and it sometimes runs in families. So while vitiligo is not as common as some other skin conditions, it still affects a significant number of people worldwide. Although vitiligo itself is not harmful or contagious, it can have a significant psychological and emotional effect on those affected, particularly due to societal attitudes towards differences in appearance. At this point, there is no cure for vitiligo, but various treatment options are available to help manage the condition and its symptoms. Usually, these are like topical corticosteroids, phototherapy, laser therapy, and depigmentation treatments for widespread vitiligo. Additionally, cosmetic camouflage can be used to conceal these patches. So it's essential for individuals with vitiligo to work closely with the dermatologists to determine the best treatment plan for their specific situation. Of course, there's alternative medicine also offers some help on these for vitiligo, which can be used in together with, say, phototherapy, and has seen good results. Next time I'll talk more about these and about using alternative treatments for vitiligo. Thank you for listening. Bye.